And okay, Dad, you can wait a couple seconds and then fire away.
Okay. Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass and Cleveland Clinic Mercy Hospital. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Jennifer Demuth, Director of Health Promotion for Tuscarawas County Health Department. Good morning, Jennifer, and welcome to the show.
Good morning. Thanks so much for having me.
There aren't many topics more widely or hotly debated than COVID-19. From vaccines to masks to public policy for schools, restaurants, and public venues, everyone has an opinion. This morning, we're fortunate enough to share this time and space with Jennifer Demuth, and we're going to set the record straight and talk about the facts and the myths surrounding COVID-19. We also want to thank Jennifer and the staff of the Tuscarawas County Health Department for their tireless efforts on behalf of the health and safety of our entire community. Thank you. We'd like to remind our listeners today that this program is also available on our podcast. Just open your favorite podcast app and look for Health Matters with the Medicine Center Pharmacy, and you can subscribe to any of our programs.
Again, Jennifer, welcome to the show. Please tell us a little bit about yourself and introduce yourself to our listeners.
Thank you. Yes, my name is Jennifer Demuth, and I am the Director of Health Promotion and Community Relations here at the Tuscarawas County Health Department. And not only have I been busy with all of our team members here at the health department, working on COVID-19 response and our other many public health essential services, but I'm also the mom of two busy teenagers at a local school in Tuscarawas County, where I live and work, and have lived and worked here in Tuscarawas County for most of my life. So I think it's nice when we talk about a community and it's somewhere that a person also lives. So, I'm able to be among the people and share in all of our successes and all of the challenges too.
So how about providing us with an update on vaccination rates for our community, along with current guidelines and recommendations for vaccinations for any listeners who have not been vaccinated? And we're talking corona, I guess.
Yes, when it comes to COVID-19 here in Ohio, at the end of August, the state announced that about 60% of the population in Ohio that's 12 and older is fully vaccinated for COVID-19. But here in Tuscarawas County, being a rural county, we do have a lot of the challenges that other rural counties across the whole US have. And that is that our vaccination rate is a little bit behind. As of the beginning of September here, we only have about 40% of our population age 12 and older fully vaccinated against COVID-19. So, we're really thankful for that, approximate 40% 12 and older who are vaccinated, but we still have, a way to go. In fact, really of our population, we have about 33,574 people fully vaccinated. So, when you look at our population being around 92,000, we still have time. We still have, a goal that we want to reach and see us get closer to hopefully 70% and more. And we do strongly encourage that folks, get the facts and, learn about the vaccine, talk to people who've had it, and hopefully make that choice to get the COVID-19 vaccine.
The news about COVID seems to change by the hour. And today there's a lot of talk about the Delta variant. Can you give our listeners an update on the status of the pandemic, both globally and in our community? Now, I heard, before I get your answer, that one of the adjoining counties is as low as 16%, which just kind of boggles my mind that it's that low.
Yes. Here in Ohio, right here at the beginning of September, the Ohio Department of Health has actually announced that our top 5 counties in Ohio for COVID-19 cases are 5 very rural counties with low vaccination rates, including some counties that adjoin Tuscarawas County. They do have some very low rates, as you noted. And the Ohio Department of Health and even the CDC has confirmed that the Delta variant is the most prevalent variant of COVID-19 currently out there, which is very concerning because the Delta variant is considered more contagious than previous variants of COVID-19. It's also considered more serious, and it does affect more young adults and children than previous variants. In the state of Ohio, as of September 2nd, we had more than 1.2 COVID-19 cases and almost 21,000 deaths at a death rate of 1.7%. In Tuscarawas County, very, very sadly, our death rate is 2.7%. So it's higher than even the state. And, I know here in Tuscarawas County, we're a community that really cares about each other and, doing everything we can, to help slow the spread of COVID-19 by choosing to get the vaccine and taking the other safety measures are going to make a big difference. Because here we are at the beginning of September with 595 active cases as of September 2nd in Tuscarawas County. And these are rates we haven't seen since January of this year. So it's concerning, but we can make those choices to get vaccinated and to take those safety steps and to try to slow the spread and take care of our neighbors and friends and those we love right here in Tuscarawas County.
We know the vaccine's free. So what about availability and ease of receiving the vaccine?
Yes, we are so fortunate. When the vaccine first came out at the end of December of 2020, it was very limited. And we had to phase out, give the vaccine out in phases. But now, ever since spring of 2021, the vaccine has been very easy to obtain. It is a free federal resource. And it is available here at the Tuscarawas County Health Department, as well as at the New Philadelphia City Health Department and many of our local pharmacies, such as the Medicine Center. And so, we do encourage that folks, check out our health departments or their local pharmacy and look into getting either the Moderna, the Pfizer, which are both 2-dose vaccines, or the 1-dose Johnson & Johnson vaccine. And the Moderna and Johnson & Johnson are approved for people who are 18 and older. And the Pfizer vaccine is the only vaccine that's approved for those 12 and older. So we encourage folks to check out their local pharmacy, call us at the health department, and we can make those appointments so you can get your vaccine.
So we keep hearing the safety concerns about the vaccine. And now the boosters are being recommended. These concerns seem to be in the forefront again. So what about the safety, protection rates, and why is this vaccine so important?
Yes, a lot of people have concerns, and we understand that. All we ask is that you take time, learn the facts, again, talk to your healthcare provider to see what is recommended for your individual situation, talk with family and friends who've had the vaccine. But when we talk about, the safety overall, the vaccine is very safe, it's very effective. It has been vetted by researchers through the CDC, the National Institutes of Health, and through multiple peer-reviewed journals and research studies. I think that's a common complaint I've heard is, all the research is through the government, but it's not all governmental researchers who've shown the effectiveness and safety of the vaccine. And that's important to know too. So if you're a person that, you're not too sure about trusting the government, there are many other researchers who have come forth and proven the effectiveness and safety of the vaccine. And we do know that the vaccine is over 94% effective against hospitalization and death. So, if you are fully vaccinated and you do get COVID-19, first of all, it's unlikely, but if you do, it's very effective against causing hospitalization or death, which ultimately shows, a very effective vaccine. There's years of research that have laid the groundwork for the vaccine that we see in the mRNA technology in the Moderna and the Pfizer. And now I'm getting a little sciencey, but this isn't something that was developed overnight. A lot of research, a lot of thought went into this, and literally millions of people all over the globe have had the vaccine with very, very few major problems. So it's very safe. And we encourage folks to get those facts, talk to their healthcare provider, and consider making that choice to get the vaccine.
Okay, what about the hesitant younger adults who say that the younger adults only get mild forms of the virus? Okay, tell me about this.
Yeah. So this is something I hear a lot. Oh, I'm young. I have a strong immunity. Younger people don't get, bad forms of the virus, or someone will say, it's, my natural immunity is going to take care of me. I exercise every day. I eat right. I take lots of vitamins. And it's true, natural immunity is important. And I know you guys at the Medicine Center have a tremendous, inventory of quality vitamins to choose from. And all of those things help, eating right, exercise, all those things boost your immunity against COVID, flu, and all kinds of viruses. But it doesn't mean you're not going to get COVID-19. And unfortunately, with the Delta variant, we are seeing more younger adults and more children getting the variant, getting this COVID, and getting it in a way that is very serious. So many hospitalizations are now in younger adults, and we're unfortunately also seeing more deaths in unvaccinated younger adults. So, consider protecting yourself, consider protecting your loved ones, and consider protecting the vulnerable folks around you by getting that vaccine and, hopefully avoiding, getting the any serious version of COVID-19.
Okay, Jennifer, first break's here. You're listening to Health Matters at the Medicine Center Pharmacy.
I'm going to grab some water.
You can grab some water anytime. It's okay.
Thank you. I'm allergic to ragweed pollen, so my voice gets a little froggy at times this time of year. So.
No kidding. Wow.
Yeah.
Not good.
No.
Not good.
Okay.
Okay, welcome back to Health Matters at the Medicine Center Pharmacy. Brad and I are talking with Jennifer Demuth, Director of Health Promotion for Tuscarawas County Health Department. So we're talking about Corona here. And so what about these boosters that we're hearing all about that I guess have not showed up yet? And what are the guidelines for these things?
Okay, so first I want to mention we do have third doses available of the COVID-19 vaccine for Pfizer and Moderna. So right now, the FDA has already approved the giving of the third dose of the COVID-19 vaccine for those who are immunocompromised, in moderately or severely immunocompromised. So some examples of folks who may qualify for a third dose of COVID-19 vaccine are those who are undergoing like active cancer treatment, those who've had certain types of organ or stem cell transplants, those who might be being treated for advanced HIV infection, those who are being treated currently with high dose corticosteroids or other types of medicines that can suppress the immune system. And that this is not a complete list. But if you think that you or a loved one has a moderate to severely compromised immune system, we're just encouraging you to talk to your medical provider and get their advice and to see if they would recommend you get that third dose of the COVID-19 vaccine. And if they recommend you get it, you want to ask them what the timing should be for when you schedule that third dose. Because especially in the case of someone who's undergoing active cancer treatment, there's a certain time period between treatments when it's best to get that third dose of the COVID-19 vaccine. So we want to make sure you have your medical provider's advice for the timing, and then you can go ahead and call your vaccine provider here at the health department or, at a local pharmacy and schedule that third dose. Those can already happen at any time, again, for those who are moderate to severely immunocompromised. Now, this can be confusing. So the next step is the booster. So the booster they're saying the White House is actually recommending that the booster could happen up to 8 months or thereafter from the second dose of Moderna or Pfizer. Right now, the FDA has not fully approved that. And I say right now, we're recording this on September 2nd. So there's a possibility by the time the show airs, it may have been approved. But as of now, the FDA is still in the process of fully approving that booster. Again, it's estimated that you would need that 8 months after the second dose of Moderna or Pfizer. And as soon as we have more information from the FDA, we'll be rolling out, more information about how we will give those booster doses. I know a lot of people have been asking us, oh no, I lost my vaccine card. How will I get my booster dose when I'm 8 months, past the second dose? And, don't worry about it. Reach out to your vaccine provider, we'll take care of you. All right.
So what do you suppose plans will be when it comes? Do you guys have an inkling? I mean, I guess you probably do more clinic days, or what do you think the health department will do once the boosters, assuming they will officially be approved?
Yes, well, that's a great question. And, we've already started to, have meetings to talk about how we might roll that out. We know that it'll be, again, sort of a phased in process because not everyone will be eligible for that booster dose at the end of September when it's anticipated to possibly, be ready. So, initially we'll be giving that dose to the emergency first responders and the healthcare workers, and of course the long-term care residents. So, we're going to work through our community partners, and we're also most likely going to try to set up days when we're doing mass vaccinations, much like we did when we gave the initial first and second doses.
We continue to have patients in the pharmacy, and I just had one yesterday that had a unique concern with respect to how quickly the vaccines were developed. And I think it's important, like you touched on earlier, that they didn't make these vaccines overnight. I mean, we have over a decade of research in trying to develop new ways for vaccines to be developed, much because there are many patients that can't tolerate flu vaccines that are made in eggs. So guess what, guys? These COVID vaccines aren't made in eggs.
Right.
And this is a new technology to make that happen. But anyway, I guess I just, I wondered if you have any comments to express and ease customers' concerns or patients' concerns about long-term side effects, or maybe things that have come up in the course of your daily practice.
Mm-hmm. No, that's a great question. We've had a lot of women in particular reach out to say, oh, I've heard that, getting the COVID-19 vaccine will affect, my fertility or my menstrual cycle. And, originally when the vaccine first came out, we didn't have a lot of research around that. But now we've had, researchers at the Cleveland Clinic, researchers at the CDC, and the National Institutes of Health, come out with studies to show it's very safe, for people who are pregnant. It's very safe for those who are of childbearing age or who are teenagers who one day, hopefully many years down the road, plan to have children. So, we're seeing that a lot of those concerns around rumors and things like that, more and more research is coming out every day to show just how safe the vaccine is. And I think it's so important for everyone to understand that just because the FDA has approved a vaccine, originally all of the vaccines were approved for emergency use only. And now, of course, Pfizer is fully approved for 16 and older, excuse me. And, they don't just approve it and then go, okay, have fun. No, they continue to monitor the safety of the vaccine throughout in its use. So they are using their V-Safe program where they're monitoring any kind of reactions people are having, and they're staying on top of that. So if and when they see any concerns, they're going to work on that and respond right away to keep us all as a population as healthy as possible. So that safety and that monitoring is continuous, and that I think is reassuring.
Okay, it is the bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
are we still on a break here or are we?
Yeah,
Okay. I'm like, wait.
I was just doing the math real quick. So our next section here will be about 10 minutes and 50 seconds. So if you want to go back in after 5 seconds, we'll be ready.
Okay. Okay, you're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Just a quick reminder that all of our stores have flu vaccine and COVID vaccine. So we have a lot more to cover this morning, so let's get back to the show.
All right. Well, when we're out at a restaurant or grocery shopping or at our place of worship, what should we be doing to keep ourselves healthy and keep those around us healthy?
That is a great question. And it's a question I'm getting every day from people all over the county and from businesses too. We need to continue those layered protection steps, washing our hands regularly and frequently, cleaning, frequently touched surfaces frequently, making sure if you are indoors that it's a well ventilated space. If you can open a window, and, obviously we highly recommend, wearing masks right now because we do have such a high level of transmission of the virus. So if you can wear a fabric, face covering that covers the nose, mouth, and chin, that is very effective in preventing transmission of the respiratory droplets that, can spread the virus. We also highly recommend avoiding crowds, especially indoors. And if you can avoid the crowds, definitely strongly consider wearing a mask and just distancing yourself as much as you can. And when it comes to distancing, yes, if you can do the 6 feet of distance, especially with unvaccinated persons or when you're out in public, that's extremely helpful and effective. And one thing, and it's still, it's fall, it's still relatively nice weather. Anything you can plan to do outdoors rather than indoors is going to really minimize the spread of the virus because obviously outdoors, you have a lot better ventilation. So we really, recommend, being outdoors. And if you are going to a restaurant, you may want to consider eating with other people who are fully vaccinated or eating with people who are already in sort of your bubble, the people you're around regularly, like your close family and friends, to avoid, exposures to others or potential exposure of yourself, to someone you wouldn't regularly eat with, because obviously to eat, you have to unmask, and above all, really, choosing to get the COVID-19 vaccine is extremely effective and is one of the best public health tools we have to help fight this pandemic. So if you're still thinking about it, you're still on the fence, we really encourage you to get that COVID-19 vaccine.
So I don't know where August went, but we're back to school.
Yeah.
And what concerns do you have for school-age children and recommendations do you have for parents or grandparents to help keep students healthy?
Yeah. Wow. With 2 teenagers in school myself, this is something I think about regularly. And, we love to see the kids be able to be in school in person because we want them to be able to get that socialization and that interaction with the other students and the teachers, because we know, that is a key to learning. And it's also a great support system for our students. So, in order to support in-person learning, the Ohio Department of Health, and the CDC and our health department does recommend wearing facial coverings in the schools. That is very effective. It's not a mandate, it's not an order, it's just a strong recommendation because we know, again, that's one of the best tools to help prevent virus transmission. And whenever possible, when schools can allow for distancing of at least 3 feet, and again, holding some activities outdoors instead of indoors where possible, and, having the frequent cleaning, all of these things, are very, very helpful and effective in the school environment. And of course, for those students and staff, 12 and older, getting the vaccine again is one of the best public health tools. And we hope that's something everyone will consider.
You've touched on the guidelines for vaccinations based on 12 and older. I am behind on the new data. Do you have any data that shows when possibly younger students may be eligible for vaccination?
Right. No, so we don't have exact data, but we do know that they are continuously studying. They have trials that are currently underway in younger children to find a COVID-19 vaccine that's safe for them. Depending on who you talk to, some say it could be months away. Some say we could have a vaccine for younger children by the end of the year. Don't quote me. Like everything in COVID-19, and this is so worth saying, as we're learning, as researchers are learning more, we're continuing to, share that information. And sometimes that information changes as we're learning more. So that's, I think, what the case will be as they research the COVID-19 vaccine for younger children. As they learn more, we'll be able to know more, and we'll share that information as we have it.
Okay, here we are up against another flu shot season. First, does the health community have a prediction for this year's flu season? And second, can folks get both the corona vaccine and the flu vaccine at the same time?
All right. So, I don't have a crystal ball. None of us does. So can we predict what's going to happen with flu season? No, it's not in the almanac. But what I can say is that we do anticipate the flu season will be more impactful than last year. Last year, we didn't see much prevalence of flu at all in our entire state. And some people said, oh, it's because you're not tracking it. Believe me, Ohio Department of Health was still tracking the flu last year. There just was very little flu to be found. And we believe that a big part of that was because we were all following those layered safety protections. We were wearing masks, we were trying to be distanced, we were cleaning regularly, in doing all we could to stop the spread of COVID. And in doing that, it also helped prevent the spread of the flu. So now that, a lot of those safety measures are recommendations, not as many may do those things. We do have more people doing things in person again, which is great, but you do see more transmission of viruses with the more things we do in person. So we do think there'll be more flu this year. Just how much, I don't know. I don't have that crystal ball. But can people get the COVID-19 vaccine and a flu vaccine at the same time? Absolutely. Like anytime you get a vaccine, you're probably going to have a sore arm. So, that's up to you. If you want to get them both at the same time, you might have two sore arms. So maybe don't plan any strenuous work with your arms the next day. But yes, you can absolutely get the COVID-19 vaccine and the flu vaccine at the same time.
You sort of alluded to this, but the masking and all that sort of things last year really cut back the amount of influenza. And so what do we got cooking, you think, this year? You think they're going to loosen up, or, some people are wearing masks and some people aren't wearing masks, and some businesses will cause you to wear, and some schools don't, and do whatever. So what's your gut feeling on this?
Well, I don't think it matters what my gut feels.
Come on, it is. It does. You're the expert.
Yeah, well, my hope is that
will it discourage folks from getting the flu shot? Because all this history's out there from last year. What do you think?
Yeah, my hope is that everyone will take time to learn the facts and assess their risk and think about how we want to protect our own health and the health of our loved ones and the health of vulnerable people around us, like, maybe a grandparent or an older person in your life. And we'll make those choices, to get the flu vaccine and to get the COVID-19 vaccine, so that we can keep transmission of these dangerous viruses down, And yeah, I just really hope people will make that choice and think about it. And maybe if those who haven't had the flu vaccine before, will hopefully make that choice to get it this year. Because one thing we don't know much about is just how sick someone will be if they get the flu and COVID-19 at the same time. COVID-19 can be very serious. And to get both, I can't even imagine. So, take time, learn the facts, and please consider getting vaccinated for flu and COVID-19 if you haven't already done so.
So what other vaccines does the health department offer?
I'm so glad you asked.
Well, I can't believe that there's the incredible amount of travel this year out of country that, there usually is for mission things, that sort of stuff. Is that true, or?
Oh, you would be surprised. This past summer, we had several people contact us. They needed a COVID-19 test that was negative in order to travel for missions work in other countries. They needed certain vaccines, to go and do a lot of missions work. We have a number of people in Tuscarawas County who are very involved in overseas work and missions. So that, while there weren't as many travelers as in past years, there still were a number of people who felt called, to go out and help in those ways. And so, yes, you can come to the Tuscarawas County Health Department and get vaccines, your well child vaccines, your back to school vaccines like meningitis and Tdap, whooping cough, HPV vaccine, hepatitis, tetanus, of course, so you can call us and get those vaccines, and we'll be here to help for all vaccine, most vaccine needs.
Do we need a reservation?
So
I want a yellow fever injection.
Well, so yeah, I think it's a good idea to call ahead. Certain vaccines that we have, in stock all the time, such as the flu vaccine, you can come and get on a walk-in basis. However, you might have a longer wait time. If you come on a day when we have a lot of other appointments, you're probably going to have a longer wait time. So we always recommend calling ahead and making an appointment. But we rarely, if ever, turn anyone away if they walk in. But again, we recommend an appointment just to keep your wait time not long. I'm sorry, your wait time short. Because we're all so busy. Nobody wants to wait too long if they can help it.
Okay. Our final breaks here. You listen to Health Matters with the Medicine Center Pharmacy.
Okay, we'll have 5 minutes and 30 seconds left. Okay,
All right.
So 1 second.
Okay, welcome back to Health Matters with the Medicine Center Pharmacy. We're talking with Jennifer Demuth from the Tuscarawas County Health Department. And thanks for joining us this morning.
All right, Jennifer, we know cases are on the rise again. What's the current recommendation for quarantining and isolation if you've been exposed to someone who tested positive?
So isolation, that is what happens if someone tests positive. If someone tests positive for COVID-19, we ask that they isolate within their homes or within a room in their homes for 10 days, at least 10 days. And their symptoms have to have improved, and they need to have been fever-free without the use of fever-reducing medication for 24 hours before coming out of isolation. So they have to meet those 3 criteria to come out of isolation. And if that person who's sick, like say someone in the family is sick, but the other family members aren't, the person in isolation, could stay in their room most of the time, and other family members could put, food by their door. Or if other family members need to interact, they could stay at least 6 feet apart and wear masks within the home. That will help reduce the chance of transmission among family members whenever possible. Obviously, in the case of when you have babies, that isn't always possible. And then those who need to quarantine, so this would be like general exposure in the community or out of anywhere else. Those who need to quarantine are those people who were exposed to a positive case of COVID-19, a person with a positive case of COVID-19 within 48 hours before that person began to have symptoms. And you had to have been within 6 feet or less of that person for 15 minutes or more within a 24-hour period. So in the case of, like, say, maybe an office environment, maybe you had a coworker named John, and you sat with John to eat a donut and coffee in the morning for 7 minutes, and then at break time at lunchtime you sat with them for another 8 minutes. Then that is 15 minutes, and that then would make you a close contact of John if John would become a positive case of COVID within the next 2 days. And so if you find out you are a close contact of a positive case, don't panic. What we'd like you to do is quarantine yourself, within your home. And the CDC recommends that kind of the gold standard for quarantine is 14 days. But, you could quarantine for as little as 10 days without testing, as long as you monitor yourself and make sure you're symptom free. And again, you're staying at home. Or it could be reduced as low as 7 days if you go ahead and get tested between days 3 and 5 and that test is negative. But even if you do the shorter quarantine of 7 or 10 days, we still recommend you monitor yourself for symptoms for the full 14 days. If at any point you would develop symptoms, please get tested and please, stay home. The bottom line is, if you're sick with anything, flu, bronchitis, COVID, stay home, please. We're seeing more and more, we're hearing from people, so-and-so showed up at work sick, how do I know if they have COVID? Well, first of all, if they're sick, don't let them come in, have them seek, care, call their provider and see, what kind of test or treatment might be recommended. So please stay home if you're sick, regardless of what kind of illness. And if you suspect, it could be COVID, or again, especially if you are a close contact, please get tested. And if you're fully vaccinated and you are a close contact, you do not have to quarantine at home. However, the CDC does now recommend that those who are fully vaccinated and become a close contact wear a facial covering at all times, except, when you're alone, for those full 14 days. And they are recommending that even fully vaccinated persons get tested between days 3 and day 5. And you're like, well, why? They're fully vaccinated. Why does the CDC recommend it? First of all, it's a recommendation, not an order. And second, with that recommendation, it's because the CDC is now seeing that some folks who are fully vaccinated can be carriers of the virus. So by being tested, we're going to see if maybe they're positive and could be carriers. And as carriers, you would need to isolate then for those, 10 days. So it's just extra precautions and things we can do to help slow the spread of COVID-19 in our community. But the bottom line is, don't be afraid. We'll walk you through the process. You're going to hear from one of us from the health department. We're going to answer your questions, and you really get a lot of information in that phone call from us. And so if you're like, whoa, I can't remember what she said about this, reach back out to us. We're going to help you. We will.
I
Hey,
think
Jennifer.
we're
We're about out of time.
Yeah.
Hit us with your contact info.
Yeah.
Right. All right. So yes, reach out to us here at the Tuscarawas County Health Department. We are here to help you through COVID-19 and also help your family meet their needs for car seats, for WIC, for immunizations. We're here for you. Reach us at www.tchdnow.org or at 330-343-5555. And you can also find us on Facebook.
Okay. Thank you to our guest, Jennifer Demuth, Director of Health Promotion for Tuscarawas County Health Department. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and of course, always we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Saturday right here on WJER.
Awesome.